Do we have what you're after? Is she here?
Northwood Tech, I think is what it is.
I thought you were looking for Rita. Okay, I'll take a motion to approve the agenda.
Yeah, I think it's.
I move
Second.
for
Anybody-
approval as presented.
Second.
All in favor?
Aye.
Aye.
Thank you. All right, approval of the
That's
minutes
as
from the
well.
January 9th meeting, 24.
Scholarships.
A long time ago.
Oh, I don't know. You have to check on those.
I'll second it.
But I think it would be,
I'll take a motion,
yeah, good.
or I mean, all in favor? Aye.
Aye.
Don't wanna,
Okay, do we have any public comment?
not sure if they wanna go to a college.
Nobody's on there anywhere? No, okay, no public comment.
We need lab tech.
Receipt of information from supervisors not seated as committee members. I don't see any. Okay. All right, number 6, rules of order discussion. Is that you, Malia, or what?
Yeah, hold on, I'm just getting my.
You want us to flip you? We want, okay. You would like us- Are you okay to flip? Okay. So number 7, we're going to flip number 6 with number 7, and we're going to have Lindsay Spindler here, UW Extension 4-H, to talk to us about the work that they do in the realm of 4-H. Thank you for coming. Appreciate your time.
Thank you so much for having me.
Swag.
Excited to be here. Just pull up a quick presentation here. So, hi, my name is Lindsay Spindler. Some of you know me. I am a Polk County longtime resident, moved away for a few years, but I grew up here, graduated from Unity. I have forever blood green. I started in 4-H when I was a Clover Bud. Chuck Preisel was my agent through my entire 4-H career, coming full circle as to when I moved back home and became a volunteer. When he retired, I jumped at the opportunity 2 years ago to step into his role because this is an important program to me. I have received a lot of benefits from this throughout my life, including when I graduated from Unity. We have a great scholarship that comes from them, from the CARE Foundation, and I got $6,000 just from graduating from 4-H, which was really, really awesome to me. So we have a lot of huge successes right now in Polk County 4-H. At the end of 2023, so our enrollment year ends August 31st. We ended up with an 8.1% increase in enrollment with 535 members. We have 141 fully certified volunteers, meaning they've gone through numerous trainings, passed background checks, and we provide lots of opportunities for continued growth for those volunteers. And we had 23 chartered 4-H clubs and groups. Those were both community groups and special interest groups. Now this year, we are having an even bigger year. Already we've surpassed our numbers from last year. As of this morning, we had 538 enrolled members, which is pretty awesome because we still have several months left in our enrollment period. And we tend to see a lot more enrollment coming right before the fair because everybody panics and they're like, wait, I want to show. So then we get a lot more from that, which is really exciting to me. We're seeing a lot of growth in our clubs. Our largest club is Cushing 4-H with 80 members, which is crazy. So we have a lot of volunteers there. They've found a really good system to make sure to support those youth and other families that are coming in. So as you can see, like, here's our membership trends since 2018. There was the dip, COVID, right? So we lost a lot of membership during that time. There was also the transition of educators. When people aren't sure what the leadership is going to be, obviously kind of panic, but hopefully we're, moving in the right direction now. And as you can see, we're moving up, which is very exciting. Our demographics for our current enrollment are kind of interesting. As you can see from our geographies, it's hard to see. I know the print is super small, but the biggest chunk in our geographies are actually town kids. So they're not coming from farms anymore. Everybody has that historical belief that you have to, have cows to show in 4-H, and that's really not true. We have a lot of really cool opportunities for youth that don't involve livestock or don't involve agriculture anymore. We have a really large robotics program right now. Kids are working. They have 3 months where they build and program robots. And then it ends in a showcase at the fair, which is really cool. And it's completely free. All of our programs are very low cost. We try to keep things, under $10 to participate in anything, if not free. All of my day camps for Clover Buds are completely free because we know that Polk County, we're not rich here, right? We need to make sure that we're making things equitable and providing opportunities for everybody. This is just kind of an interesting map. You can see the concentration of enrolled members. We actually have, so some of these dots up here, these are actually our kids. So you don't have to live in the county to be enrolled in Polk County 4-H, which is really cool. We actually have several members that are in Minnesota. We even have some volunteers that live in North Dakota, but they come back in the summers. They're college kids or people who live out of the state during, come back in the summer to help volunteer for horse programs or other opportunities to help our youth.
Is that like kids would want to come in and show at the Polk County Fair from
Mhm.
across the border?
Yeah, or, so like one of them, she lives in Scandia. They just don't have as robust of a program there in terms of, like, they're really into dog training, right? So we have this, I don't know if you know this, but we provide 10 weeks of 2 nights a week training in obedience, showmanship, rally, and agility. And it costs $20 for kids. So they're getting hundreds of dollars worth of training, right? For their dogs and for these handlers for 20 bucks. That's nothing, right? And so because we have these strong volunteers that have this amazing knowledge base, we're able to build out these really robust programs. And so it's drawing in kids from other counties, other states, because we have that. So, which is really great. So I'm going to talk a little bit about impact. So we use the thriving model in 4-H. And through this, it really focuses on academic and vocational success, that civic engagement, right? Using our hands for larger service, employment and economic stability and happiness and well-being. We're really looking at the whole child versus, just one or two things. We want to find things that spark their interests, that draw them in, and really, make sure that they feel supported in the community. We focus a lot on youth adult partnerships and try to build that out so that, I think 6 trainers in the state of Wisconsin for this supporting youth mental health training. So we did that. I teach it once a month to the any enrolled volunteer in the state of Wisconsin. And how to support our kids better and making sure that we're catching those signs and symptoms of a mental health challenge and that kind of thing. So we're really focusing on the well-being of the youth. So here we have our thriving model. And when we talk about youth thriving and building up our programs to make sure that we're supporting them, it all starts with the soil, right? So we're starting down here, and this is where our 4-H programs are developed. And we focus on these 4 kind of components: belonging, sparks, relationships, and engagement. So whenever we're providing an opportunity, we really want to focus on those to help build up youth all the way up to the flower, right? Those long-term outcomes, those are the things where the kids really shine. And that goes back to those 4 pieces that were on the previous slide. So every year we do an impact survey, and I actually have copies if anybody is interested. I don't have a ton, but I will leave them here. So this is our Wisconsin 4-H impact survey. Our data though for Polk County is pretty awesome. It's nice to see that we are above the state average for all of these things. So sparks are what really engage the kids. Like what are they interested in? What, really ignites them? So, this is on a 0 to 7 scale. So anything higher than a 6.2 is very high quality. So 5.7 would be high quality. Belonging, so they have that sense of belonging. They have that sense of community. So, having a 6 there is pretty great. Caring adults, because we have those trained volunteers that really work to build the relationships. We score really high there. And those youth adult partnerships. And part of that is making sure that the youth have a voice. They have ownership in what they're doing. We're constantly making sure that they're the ones driving the programs, not the adults. We're not the important ones. This isn't our program, this is their program. So making sure that they have that understanding that they are the ones who are making the decisions and the choices that will shape what they do throughout the year. So our 4-H youth thriving? Yeah, they're doing awesome. So like I said, they take this survey every year, and we score really, really high. One thing that we do need to focus more on is that goal management. We do a lot of record books, but record books, I don't know if you've ever been in 4-H, they are the bane of everyone's existence, right? At the end of the year, we have to talk about what we learned and all that, and kids don't see this kind of the why behind it. So that's something that's kind of my goal this year, is to make sure that youth understand how to set goals and how to keep working on those throughout the year. So doing more education on my part will help us drive up that goal management score. So what are our current programs? What are we offering in 4-H? Polk County is really unique, right? We have some really awesome things happening. Like I said, we had 141 enrolled volunteers. Having that many people who want to give back to their community is amazing. Lending their knowledge through textile workshops or robotics or coaching kids. We have volunteers. So the second group here, Gwen Dato, every Sunday morning, 6:30 a.m. She has 8 kids show up at her house and they practice Dairy Quiz Bowl for months. I mean, that dedication is crazy. So it's awesome to see that. So with that though, we're the state champions in Dairy Quiz Bowl right now for both the senior team and the mixed team, which is really cool to have 2 teams that placed first at state. That senior team will be going to nationals in Louisville, Kentucky in November, which is just cool. We're also building a lot of opportunities for youth through partnerships with schools and public libraries. And that's one of my goals as well, to continue building up, giving those opportunities for maybe youth that can't get to a community club meeting because of parents working during weekends, or, transportation being a huge factor of that, or time. So making sure that I'm providing opportunities for youth that wouldn't normally make those different experiences. So I did a library program at the St. Croix Falls Library called Building Up Steam. It was a year-long, once-a-month program, met with youth for 2 hours once a month. And we did really cool things. This is a Rube Goldberg project where they had to build a machine, right, that had to go through several steps to spill beans into a bowl, right? But it couldn't just be one step. It had to be all these different things, was chain reaction. Really cool. We also have a really well-established Leaders Federation. They do a lot of fundraising to make sure that anything a kid wants to go to, whether it's local, state, or a national trip, they go and they don't pay. Or if they do pay, they pay half or less than half of that cost. So here's a picture of Space Camp. Last year, I had the opportunity to go with, we took 200 youth from the state of Wisconsin to Huntsville, Alabama, to the National Space and Rocket Center there. And they trained as astronauts for 3 days. It was so fun. And, my son was one of them, and, watching him grow and really engage in something that sparks his creativity was just amazing to me. And he paid less than half the cost. It was a $900 trip. We paid $400. I'm taking a group of youth tomorrow, flight leaves at 6 a.m. to Washington, D.C. Those kids, $0. Going to a 5-day youth summit. The Leaders Federation cares. They know the importance of giving youth that opportunity and making sure that, if you want to go, you'll go, right? So So with that, this trip tomorrow, we're attending Ignite by 4-H, which is our Lead the Change. Part of it is this Lead the Change project. Polk County is the only county in Wisconsin selected to go. We applied. We had to write up a program proposal or project proposal. And we wanted to change the perception of agriculture in Polk County. And through outreach, they're going to do work at farmers markets. They're going to attend community events. They're going to make displays and talk to people at the fair. So we wrote up this huge proposal. We're the only county that was selected. And it was funded. Yeah, it's pretty awesome. 72 counties and we're the ones. And so I'm taking 4 high school youth to Washington, DC to attend this summit. They're going to meet with legislators. They're going to listen to some really amazing keynote speakers. They're going to talk about some career paths, not just in agriculture, but healthy living and STEM. We also get to do some fun tours, which is really great too. And visit some different businesses related to the agriculture industry. So this is going to be my founding team for our 4-H Ag Ambassadors. So this is my kickoff to that. We have a lot of youth that are very passionate about agriculture, and they see the importance of the industry. And it's great that they're leading the charge in this. I tasked them with fundraising. They went out and raised $7,000 in 2 weeks. Just like stood back because they're so motivated by this project and this opportunity that they just did the work. I was able to attend. This is my group that I went with last year. We had one youth, Haley, in the purple sweatshirt there, from Polk County that went. She was one that I nominated for the Ag Ambassador team for the state of Wisconsin. And so I just went as like an extra chaperone last year. This year it's mine. So, which is really awesome. So we also offer Cloverbud day camps. Like I said, these are completely free. They're open to not just 4-H members. Any youth that are in kindergarten through 3rd grade can attend. I offer them 4, sometimes 5 times a year, depending on my schedule. And I try to move it throughout the county. I try to make sure that I'm not just meeting in one location to give more opportunity for people to attend. I have to cap these at 20. I have to. Otherwise, I end up with 30, 40 kids, and that's just not attainable because it's just me and a bunch of my team leaders that run these. So it provides opportunities for youth to explore many different areas of 4-H. And I try to do it around themes. We do food, we do STEM, we do fall fun. We did a Halloween one with spooky science. It also helps to build those relationships between those young kids and our older youth and adults. Another thing we offer is summer camps. We do a base camp that's open through grades 3 through 6 and an outpost, which is what I run. In grades 7 through 8. We do it at Marine on St. Croix. We canoe down the river. It's great. Get kids out in nature, get them exploring and working and building those relationships. Our Leaders Federation, once again, knows the importance of this. It costs the kids for a 3-day camp, transportation, food, lodging, all that included $30. Nothing, right? So, we really try to make sure that all youth can attend these things. We also partnership with other county departments. Land and Water comes in. They do programs for us. Last year, they did 2 hours on invasive species identification and water testing. You should have seen the kids. They were just in awe of everything. They were out with the dip nets and looking at the water, and it was just amazing. We also work with Food Wise, which is another extension program. They came out and they did pizzas on the grill. So, and the kids made the dough and, cut the veggies and did everything completely assembled and then grilled it outside. So it was really pretty fun. So, Polk County and 4-H, how can we work together, right? The important thing with 4-H is, we have these ways of building interest in different projects. So there's something for everybody here. We're also trying to build more membership in school-based programs, so working through classrooms and also increasing that connection to community. So through those community service activities that we do, it's a good way for youth to give back. So currently, we've partnered with community services through their substance abuse prevention program. We're working with them on providing help for their youth empowerment summit. I'm pulling my teen leaders. They're going to be kind of the, I don't know, like camp counselors of the day, right? Because they know how to work with those youth. We put a lot of training into our counselors and to our teen leaders so that they're able to go out and then offer those services elsewhere. We're also working to pack quit kits for prenatal and postnatal. So those, the youth will pack the kits. We've also worked with the mental health task force on the same thing, packing the preschool pre-screening bags, right? We packed, I don't know, 200 some bags last year for the mental health task force. We're also working with my Ignite Ag Ambassadors group to help out at the farmers markets this summer, so we're going to do some partnerships there. So we're always looking for opportunities to give back to Polk County because it's important that the youth know how to do that and, make sure that they are building those connections. And, having those strong bonds to community is one of the best prevention programs that we could have, right? So when we talk about substance abuse, youth need to have the connections to strong adults, to community partners. They need to know the resources that are available to them. And the more we can get youth involved in 4-H, right? And building those relationships and building, the knowledge base that we have for them, the better off we're going to be in the long run. So that's basically what I have today. So if there's any questions about 4-H or, what we can do for Polk County as a whole, I'm happy to take those.
Who are the 4 kids that are going to Washington with you?
So we have Callie Anderson, Darby Trent, and Allison Emerson, all from Amory. And then we have Aubrey Gott, who's from Osceola. So
I sure like to congratulate them. I graduated from 4-H in 1953, and I kind of majored in electricity, and boy, it just benefited me my whole life.
that's awesome. Yeah, it's a good program. There's so many benefits to it. So, and I mean, obviously, like I was a teacher for 14 years, and but my passion I always wanted to get back into this. And so I did some backfill in Minnesota. I actually did 3 consecutive summers in Clearwater County because they couldn't keep an educator around, I guess. And then I was recruited to come to Anoka County, and I did a backfill position in Anoka County 4-H for 4 months. And it's always something that I wanted to get back into. So when Chuck retired, I was very excited, and he encouraged me to apply too because we have a good relationship.
Everything you do for those kids makes God smile and everybody else too.
Thanks, Johnny.
So Lindsay and I had talked months about doing this today. And like, for me, this is exactly why, because I would have said, yeah, 4-H is a great program, but then I get to see all of this and I actually get to see how great of a program it is and learn about like how far reaching it is and everything like that. So, and it sounds like you've already good relationships with departments here.
Mm-hmm.
And so I think it's just worth kind of earmarking moving forward, keeping as much communication open as possible to make sure, because this is exactly so well representative of Polk County and our kids and leadership and things like that. And it's indirectly and directly related with some of our county's top goals and things like that. Because like you said, if kids get this kind of experience in they're gonna have less of a chance, it's a greater chance of becoming, healthy and
Mhm. It's that well-rounded individual, right? We're not focusing on just like or academic success, right? Or you're gonna be an athlete, right? It's everything. So,
yeah,
and
so I guess just whatever we can do to support, to make sure that this is continuing that positive momentum and having the impact that it's having.
the biggest thing right now is it's me. I'm it.
Yeah.
I'm the only one. And so we are working to get an AmeriCorps member. The problem is our location. Those college kids, they're not close enough to be, because part of the AmeriCorps program is they need to be here. I need to have like eyes on them to certify their hours, right? And so it's not like it can be a remote position. So, I'm trying to get an AmeriCorps, I'm trying to get additional, I'll have an intern this summer, but those like school programs throughout the year, I can't reach everywhere in the county. So trying to develop other ways to do that, to make sure that I'm,
So like even UW River Falls, that's too far
Too
for,
yeah. So I had applied for an AmeriCorps and like, you can see, we've got one, like we received a position. But I couldn't fill it, so I had to pass my position to Pierce County because they have River Falls right there. So, but if you know any college age kids.
Rice Lake
or-
isn't close enough.
No. And I am still actively recruiting one for summer, so I can get a quarter-time member for summer, so I'd have an intern full-time, and then I'll have a quarter-time member. Leaders Federation agreed to pay, because I don't really have enough to cover, or don't really know how to cover it from my own budget, but my Leaders Federation said that they would pay the portion that we need to pay. It's really, really cheap. It's like,
What are the criteria for being a AmeriCorps?
so they have to be 18 or over and have a GED or equivalent. So that's it. They don't even have to be going into education or anything at all. I just need an 18-year-old that's already graduated. So if you know anybody.
Anybody else have any other? Go ahead, Bill.
Lindsay, how do you connect with the school's FFA programs?
So I do reach out to them. I provide any opportunities for those youth that may be showing livestock. I do all of our youth quality care of animal trainings, which is a requirement to participate in our auction. So I make sure that the FFA knows what that is. Yeah, I basically pass on information, and I'm kind of the communication point between the fair and FFA.
Okay.
Is the AmeriCorps a position, a paid position?
Yes, so they get a living allowance. We can't call it a salary, but they get a living allowance. And then they also get an educational credit or educational award, financial award at the completion of their hours.
And how long is this a commitment?
So my quarter-time member would run May through August. So summer.
What's the educational award?
It's 1,500,
Just summer.
something like that. It's around 1,000 something.
Okay. Anybody else have any other
That
questions?
sounds. Can I find you if I can look you up?
Mhm.
Just look you up?
Yeah.
Okay, thank you.
Otherwise, our offices are located in the basement.
Something like this.
And my email is just
Good idea.
lindsay.spindler.edu, so pretty easy to find me. Yeah, we're right at the bottom of the stairs over here in the extension office. I know, right?
What a gig, huh?
Not everybody.
Well, thank you for coming. I echo Ryan's stuff. So if you need anything, come to us. And I really appreciate how much you've part the team over there and all the work that you. Really important.
Mhm.
Thank you.
Thank you.
CJCC coordinator had a question.
Oh, yeah.
Oh, I'm sorry.
Is it that UW River Falls and Rice Lake, you don't have students that want to make the drive, or is there like a criteria of how?
No, so yeah, it's just they don't want to, if they live in that location and they have to drive an hour here. Yeah, it's just been hard to get anybody.
I have an unpaid intern from UW River Falls for CJCC right now, who's here 3 days a week. Really?
They want.
Yeah,
Two
2 days a week, they can just shift over here. I can come holidays.
I can talk to her.
Yeah, maybe, let me know.
There you go.
I did, it was like, you know, like the drive,
Yeah.
it's just the difference.
Right.
Yeah, I have.
All right, let's, are you ready?
Yes, sorry.
Okay, so,
So Shabana and I got together, several hours on multiple days and went through the rules of order and then worked with Mo to make, I guess you would call it staff's recommended changes. And then on each committee, just the section that deals with the rules of order as they relate to your committee or this board. This is the opportunity to discuss and make any recommended changes, not make them, but recommend them because it will be the next board that's seated in April that will make their own rules of order. So this is the opportunity to make suggestions. The only change for the section regarding Health and Human Services, as you can see, is capitalizing CRA for Community Referral Agency.
where's that?
Um,
Are you?
so if you go to the rules of order page, Health and Human Services starts at D towards the bottom of page 12 of 14.
Yep, we're in our packet.
Yeah.
You guys got
And adding the ARC. Agency reports or has connections with it.
it. Is there any other things you wanted to highlight?
Nothing from staff, but if there's any discussion, and there doesn't need to be, you don't need to try to find something, but if you had something specific to this Health and Human Services Board that you wanted considered, this would be the opportunity.
Malia,
Yeah.
Aging and Disability Resource Center, they would just be informational only
Yes.
to us because
We know they have their own board. Yep.
Okay, thank you.
Yep.
Other program.
Ryan, do you have anything?
I know that there was some discussion about that. They do have their own governing board. This board would not be governing them, but it would be the board that reports, and it's a conduit because they're receiving levy dollars.
Their contract does come from the county board, signed from the county board.
Well, they have county board members on their committee who would be able to report up.
But they are not our committee. We have, I mean, we have liaisons on there, but they are not a county board committee. This is
You're saying ADRC is assigned to Health and Human Services, and that's why it's,
just for reporting.
yeah,
Yep.
Not for governing.
yeah. Anybody else have? Yes.
So, when I was assigned to, well, came into the board, somebody had recommended I go to the YouTube channel and view all of the rules of order and the parliamentarian videos. Yeah, they have like eight different courses that you can take, and they're like 5 minutes. Minute. What?
Sorry.
Before somebody uses the restroom. Thank you.
Well, Amy shocked me this morning.
I touched her and shocked her and said her.
Jumpy, extremely jumpy, but that might, I can push through that data. I mean, I just
It might be a
remembering what happened at, the last full board meeting with the rules of order and the parliamentary process and everything. I think it'd be maybe a good refresher, or
Is it like something that's put on by extension?
it's the University of Wisconsin. It's,
Okay.
I think it's actually from their parliamentarian course.
Because to be a certified parliamentarian, incredibly difficult.
It is, there's a lot of,
No one will be an expert in.
right. But it starts out, I mean, it's really basic.
Starting
It's perfect for this.
Yes. No, I think that's great.
I'll shoot you that, and
That would be
we
really-
could mention that in the rules.
Well, and it would be, it sounds like it's a good orientation resource.
It is,
So.
but it
maybe that's-
also is a good refresher,
Yeah, right, right.
you know.
WCA also has something where they will actually come to a county board meeting and do like parliamentary procedure specifically for county board supervisors. I have been looking into it all.
Good. Yeah, we had one of them coming early.
It did.
Did something. I can't remember what.
Those videos.
Extension report, where does extension report up to in 4-H?
I don't know.
Extension,
Isn't it?
Yep.
General
general
government.
government.
So. Does it need to be spelled out on this, in this? Does it need to be spelled out, listed as one of the outside entities that reports up to GenGov?
So it was my understanding that UW Extension doesn't come to anything anymore except for the Ag Section 2 ES. Which is why we kind of changed that, but I don't see it on unless there is still something else coming from Extension.
Let me check
Well,
something.
they have other functions that they're providing here. Lisa Bent's position. And then.
There was the move, right, where extension used to only report to ES. And then that was changed,
Right, because of the egg statute,
right?
to go through that. As far as budgetary and funding, they present then to general government as an outside agency.
Should they be listed?
Yeah, they're not.
And then the food wise, is food wise under? Which one?
I've never heard of that.
So they were an
Well, it's all
extension.
part of extension.
Right, they're an extension program.
So you're wondering where we,
4-H only. There's other stuff.
There's a lot more.
are you, did you get your question answered? I'm trying to figure out where to put,
My question, it's your question.
no, but I
Well,
mean,
general government meets tomorrow. And this is on their agenda. So we can talk to them about
So should
whether they
supervisor
want to be listed.
plan to go to that meeting?
I just noticed it wasn't on anything. And they are funded through the county, so that it probably should be on these committee.
It should be on general
The other
government for
part.
funding.
Because when we split it from ag, we lost the other half or whatever part. Well,
Yeah, we'll add that into general government.
I see what you're saying. Yeah, right.
it
Yeah,
just-
we don't want to lose that part.
The other part got
Yeah,
lost.
okay.
Okay. I'll add that in there.
Anybody else have anything? So I had a question on the rules of order embedding in the code of ethics. So just a little quick briefer, we've been working in extension for executive for a couple years, like, on updating our rules of order to also include our code of ethics and updating our code of ethics, which is from 2008. And you had the good idea at that point to say they should be embedded in here.
Yep.
So we should be looking at the whole bundle.
Yeah, we'll bring those. It's not separately listed as an agenda item, but as long as we're talking about incorporating code of ethics into the rules of order, which I think is a reasonable idea. Let's talk about that on Thursday at.
We'll just do that at executive.
Yeah.
So,
You guys want to do it at Gen Gov? Or
Everything's broken up, split up, and then executive will look at the whole thing.
we do the big
together.
picture?
Okay,
Okay,
they're the,
okay.
Are we just talking about general rules of order stuff now?
Well, we just have our little section here that the whole,
Yeah, I
rule-
saw the,
yeah, it's just whatever the edits are from our little world. Did you have something bigger?
I just had that curiosity. I'd brought it up a long time ago about committee appointments in general and avoiding the idea of making it more representative and the idea of avoiding having the same people on every committee year over year. And I just didn't know if that was a group conversation that anybody would want to have, or because I've gone through it a million times and I don't know how to come up with anything that doesn't create more problems in its wake and how to do it.
Like term limits on committees? Is that what
Way.
kind of?
Yeah.
Yeah, I thought I could Would that be a,
Yeah.
discussion that we could have at the board meeting
Yep, it would be
under?
the board agenda for a general discussion. So this board won't actually change the rules.
Right.
They're just kind of,
Yep.
yeah,
So we can talk about it on the 19th.
yes.
So would that, what part of the agenda would that be? How would that,
It's gonna be its own separate agenda item, right, Shabana?
Mhm.
so whatever we're talking about can get talked about with
Yep,
whatever you're,
or at executive would be probably
it'll
more
probably be both.
prevalent of a discussion, because then we'll take that stuff and bring it to the board and then can be discussed there.
So
So
you have an idea.
Why don't you craft me some
I have an
language?
outcome
I know.
that's lacking in idea.
Yeah, yeah. So if you, I don't know, reverse engineer
Yeah.
and,
So Malia and I, anybody else will be at and Kim will be at executive. If you want to get one of
I can
us
put something,
thing, just
yeah.
a couple sentences about where we're headed here, then we can start that conversation.
Mhm.
Okay. Are we done? Anything else? Okay. You've been very patient.
Oh, Amy, I'd have a question about what you're trying to attain by having term limits on committees. You need to retain some kind of experience on the committees, and as board members, we serve actually on multiple committees. So, yeah, it's,
That might not have been the
I
right
think-
word. I was just trying to, you're right, John.
Yeah, but John,
madam,
Yeah, go ahead.
but then again, Johnny, you can't poo-poo somebody's experience. Like if the good doctor here was on the board and he could not be on the Health and Human Services.
Right, that's the problem. Yeah.
Right.
You don't
Well,
want-
and Dr. Lagos is a perfect example. I mean, I would certainly I would certainly hate to lose Dr. Lagos' experience and continuing knowledge by kicking him off on a term limit. That's just not progressive, I don't believe.
No, and that wouldn't be the goal of
You're missing
anything
the
like
point.
that.
Yeah, you're missing the point.
Yeah, I don't think term limits was the right word. I just was trying to figure out what Ryan was saying.
Are you talking
Yeah.
about county board supervisors or?
Yeah, I wouldn't-
Because these guys are citizen members,
County
that's our charge.
supervisors.
That's why the conversation would
Have
be
the
good, because you could say, citizen members aren't a
Yep.
part of that, but county board members, otherwise you end up with committees that have the same representation year over year over year over year, and it's not really representative to the county.
Right.
Right.
And now we have to.
And that's where those citizen members help out a ton.
Right. Okay,
Kind of think we're getting off the agenda there.
yeah, thank you. All right, we're gonna have an update now from CJCC. Thank you, Melissa.
You're sitting.
Front load this a little bit of why she's here, because this was back a few months, many months ago,
Can't even remember exactly.
the beginning of the harm reduction
Well, I
discussion.
I agree.
I think, yes, so to,
Scientist right here.
to remind you guys, to remind the committee members and
What other people come up with.
should we just adjourn? Okay, so we had a lot of conversation around harm reduction and harm reduction techniques, and we all kind of got up to that, and we had a lot of conversations. So that was, out of that came a question of whether we could get an update from you guys on where things were at. I guess it was a while ago.
Yeah, it was suggested that we bring CJCC just because of the connection
And
and harm reduction and that programming that you guys do. You were on leave at the time, so we tabled it until now.
And I believe Supervisor McAfee made the request and is not here because she's out of town for work, but she came to drug court the other day and loved it. She was raving about it. So I think that was part of it also.
It helps that she came on a graduation day, which are always like high notes, not one of
Yeah.
the weeks where everyone's doing terribly.
Right.
So we always appreciate those. So I think I've met most of the people in the room, but my name's Melissa. I'm the CJCC coordinator. So I'll just quick give an update on like what our programs are and kind of like what we do for them. We run 4 programs. So we have the first time offender program, which is for low risk individuals who have never been in trouble with the law before. or maybe they've had like a citation or something. And so this is a way for them to get their charge dropped. It's typically misdemeanor charges. In the past, we have done, it's been just kind of like online classes. We are switching that in April. Our diversion case manager just revamped that. So we will be having an in-person class for the person to discuss what led to their charge, how they were feeling at the time, things they could do better. It will also involve just education on what a criminal charge does to you, how it affects housing, how it affects potential careers, all of that. And there will be a jail tour with that. Not trying to scare people, but just that's the reality. If you continue to get more charges, like this is where you'll end up spending time. We have the intoxicated driver intervention program, which is for OWI seconds and thirds. With that, people reduce their fees that they would be charged. They reduce their jail time. But through that, they're in this program for a while getting AODA treatment. They're doing drug testing several times a week. They're meeting with a case manager, and they're also doing community service hours to reduce that jail time. We also have our substance diversion program, which is for some like medium and high risk people. It's a lot of felony possession of like fentanyl, heroin, methamphetamine. It's also people that may have had a drug issue for a while, but do not have criminal charges at this time. And so that's a program for them to avoid having a felony charge if they successfully complete that program. And so again, with that, they are getting mental health treatment if it's recommended, and then going through AODA treatment. And then we have our treatment court, which is high risk, high needs. That's people a lot of times who have already been in prison, got out, continue on the same cycle, and it's kind of their last chance before returning to prison, or people that are in prison for a number of years and it's their last chance before prison. So we did just have a graduation. We're looking to have another graduation the first Friday in April. And then we do have a couple of people that will be graduating this summer as well. And so as far as harm reduction goes, our programs are primarily grant funded through the state. And so we don't really use a harm reduction model. Ours are abstinence only. We do work with people though, if they are testing positive for substances. The first thing we do is not to kick people out of the program. We work with them. And so we do, especially for treatment court, if you continue to use, we have a treatment response. So sometimes that means working with probation to send people to intensive inpatient therapy, or we increase the treatments that they're having. So as far as harm reduction, we work with people, but eventually we get to a point where if people continue to use and we're not able to meet their needs, then we do have to terminate people from our programs. Does anyone have any questions or like what kind of harm reduction questions?
I don't know if I do. I was wondering when you said that you can send people for more treatment, do we have places to send people for more treatment? I mean, once they get beyond what we can kind of handle in this room, where do they go? I mean, are there beds?
So for substance diversion, we haven't run into this a lot, but we have worked with Lisa Lavasser with behavioral health for some county funding. So a lot of times people are on Badger Care, so we can get like room and board, or not room and board covered, we can get inpatient covered. But then Lisa does have some grant funds that she's able to use to cover that room and board piece that Badger Care has not been covering. It's been a while since we've run into that, and not since we've been having hospitals closing. And then treatment court, people are on probation. So probation is the one actually doing that referral and sending to like Affinity House in Eau Claire. I'm trying to think of the other ones. So we do have beds open, but people are waiting months for that. So that's the downfall. But the bonus with that is that probation's able to cover it.
Oh, I see.
So,
Okay.
yeah.
Amy, as board members, I think the general public out there seems to think that that there isn't any education as far as drug advancement education goes. They think, wow, they just get a slap in the wrist, and that's to me, that's the best thing we have going in the county right now. Is yeah, we do, you know, try and help the people to get off the addiction, and we need to inform the people. Yeah, we're trying to do as a county what we can to help rehabilitate, because it is rehabilitation, and addiction is probably the toughest thing there is.
Yeah, and with that, I'm glad you brought that up. So not everyone is eligible for our programs. And because we're grant funded, we cannot take people that have past violent charges in their criminal history. But
Exactly.
I know with the DA's office, when people are being, like going through sentencing, et cetera, if their charges involve substance use, then they are making like AODA assessments part of that sentencing, and probation. I mean, most people are getting probation when they're being sentenced around here, especially if it involves substance use. They are having to work with probation to address some of the substance use issues as well.
And thanks for the nice presentation you made at the public protection last Tuesday.
Oh, you're welcome.
I'm a numbers girl.
Okay.
You know that. Do you have, data? And like, how many go through the program, how many graduate, how long it
Yeah, we
takes?
could pull up the dashboard, Claire, if you're fine with doing that.
Or you
Does she have a date on that? Does she have a date on that April graduation? I'll be home on Thursday, and I'll try and attend that April graduation. I think that's important to show those people that we are concerned about their progress.
Yeah, so I believe it's the first Friday in April. I don't have my
Fifth.
calendar up. Is it the
Fifth.
5th? Yeah, so Friday the 5th, John.
Okay, I got that on the calendar.
I'll try to go with you.
Okay.
What time is that
Yeah,
at?
I'll be home. I'll be home on Thursday.
It starts at 9, and then following that, we do the like cake and refreshments afterwards. So if you just want to pull up diversion programming. So March numbers won't be in because that's in progress. But you can see for treatment court, February, we're at 14. Substance diversion, we're at 4. First time offender and IDIP, we didn't have anyone in January or February. Our IDIP program, we're working with the judges right now, because what's been happening is that people have been doing community service hours and getting credit in court and reducing their jail sentence. So defense attorneys right now are like, why go through this, intensive program when we can knock some jail time off this way? So we are going to be meeting with the judges, the diversion case manager and I soon, to try to work that out. So people are either doing the program and getting credit, or they're not doing the program and they don't get that reduced jail time. Because with the program, you have that increased accountability of drug testing, meeting with the case manager, giving back to the community through community service hours.
So is it just the judges that you're gonna meet with so that they can basically understand the importance of this program?
Yes.
That's convert to public service where you sign sheets of paper.
Yep. And yeah, and we used to
The
have,
DAs or did you say the DA's office too?
no, the DA's office is giving referrals for IDIP. It's just that defense attorneys know that right now their clients can just do some community service hours.
Right, the clients get the
Report that to the
benefit of the
judge.
program without actually having to go to the program as long as they do this. So she's gonna try to hold a mirror up to the judges.
Educate the judges.
Yeah, because we used to have quite a few people in IDIP, and then after defense attorneys started realizing they could kind of reduce jail time without doing the program, they've clung to that, so. Which you can't blame them.
Yeah, they figured out a loophole.
Yeah, you can.
Well, thank you.
Just me.
We went to Barron County, a group of us, including Melissa. We went to Barron County and shadowed their family treatment court. So that's not criminal charge stuff. That's cases where children have been removed from the home for reasons surrounding a parent's substance abuse. And so it's like our child welfare cases, but they do it in a way where they're meeting with the judge every other week. Where our judges, once the case is sort of processed through from trial, the judges will see them once every 6 months. But they're every 2 weeks and keeping parents accountable, and it was very cool, and we're looking at some point in the future incorporating something like that in Polk County, because that would be a huge need.
Yeah, it runs the same as our treatment court. It's just that it, instead of substance use charges or crimes involving substance use, it is the fixed cases. And that
And I
model,
think you got an example there that communication is the key to success.
Yes,
Yeah.
I agree. They need to be educated.
Also, I am a little bit unrelated, but Judge Anderson has repeated to me a couple times that he is open for ride-alongs, he calls them. And so I'm actually going to do a ride-along with him in a couple weeks for next week. So for you supervisors that are interested, he might be. I mean, you can still, anyway. Okay, moving right along. So update on housing. Is that you, Mo?
I can take that. With the initiative passed by the board for the housing and the applications that are out there, we still have not received any applications from any municipality wanting to get into the program. We're hopeful that we have a couple that are pending, that are interested in talking about it with economic or EDC. So, but as of yet, we have no applicants yet for the program.
And I noticed EDC was promoting their 2 breakfasts, and one of the things on the agenda was to let people know about the housing opportunities. This is one of them that they're going to talk about, right?
Yes.
Okay, good. Any questions on this? Okay, number 10, communicable disease report.
All right, in February 2024, we had 8 chlamydia cases, so chlamydia numbers remained high. 6 COVID hospitalizations, 3 influenza-associated hospitalizations, 6 RSV-associated hospitalizations, 2 cases of varicella chickenpox, and then just a handful gonorrhea, hepatitis, fun stuff.
What was the first one?
Chlamydia.
Chlamydia.
Mhm.
How many was that?
8. Numbers are staying high.
No measles.
No measles. Message is going out. We're watching that.
What's the influenza? Are we seeing a uptick in influenza, or is it pretty low?
Well, and only influenza cases that have been are hospitalized for over 24 hours is reportable. So we're at 3.
Okay.
For February.
And I have a question. So in honor of, I listened to Dr. Olstrom-Holmes' podcast, and one of the things that it was new to me was they're recommending 65 and older inter-year COVID shot right now, another one right now.
Correct.
Right?
Yes.
Do we have it around? Do you know? Yeah. It's around?
Public health, yes, it's around. Yep. In public health, we have COVID vaccine only for those who are underinsured or uninsured.
Okay.
So we were able to give it at no cost. So we would be referring anybody else looking for their another COVID shot to their medical providers, the local pharmacies.
Okay.
And 65 and above, obviously, Medicare covers it at the local pharmacies.
Yep.
How do I know that?
Okay.
Well, yeah, I was going to make a couple other comments from Dr. Osterholm's latest podcast on 306. I listened to it for an hour last night, and I think the issue here, one of the issues is that COVID is still alive and well, and there were 30,000 people in the hospitals in the US in January. Then went down to about 15,000 on February 24th, which is the latest data that we have. And in January, we're still seeing 2,500 deaths a week in January, and it has dropped down to about 1,600 in February per week. And then most of these people are 65 and over, the majority. And the concern is that we have. And then the other thing they've noticed is that COVID increases the risk of inflammatory autoimmune disease by 25 to 30%, 30 days post-infection. So there's other things that you can end up with besides that. And so the concern is that we have about 18% of the people in the US are vaccinated. Great, 22% of people 18 and over are vaccinated, and then only 42% over 65 are vaccinated. And nursing home, it's about 40% vaccinated. So if you have any parents, grandparents, or neighbors in nursing homes who are not vaccinated, you should try to get them convinced to get them vaccinated. And so it's I think because he is saying that Dr. Osterholm is saying that the vaccine is safe. I actually I came across somebody in a report in the beginning of March that one guy had 217 COVID vaccine doses. I don't know how aware this was, but the comment was it hasn't harmed his immune system. And so it's kind of like, and so I'm trying to think. I think I got my last booster. I think maybe in November, and Dr. Osterholm got his last booster last Saturday. Even though he had COVID a year ago and still had symptoms 4 months after he had his COVID in last March, and so he's quite aware with the fatigue with COVID, and there is concern that there is some IQ loss if you get COVID. I think it behooves us to, those of us over 65, we get our booster. There's still talk about this I-17 variant, and there's a new variant which is the most predominant strain in the U.S. currently. And there's a new strain, but it's only about 10% of the world, and they don't know how infective it's going to be. And so it's, well, stay tuned. And there will be a new booster vaccine next fall. But his argument is that we should not be going to just once a year shot, is because immunity even from these boosters wanes over time, and currently there's outbreaks in South America and Japan, and so if you're a traveler going to go to anywhere in the world, check with the CDC what their latest recommendations are. And the other thing that's come up is that CDC is now recommending that if you have COVID and you're free of any fever for 24 hours, you can go back to work. And that's been kind of controversial, and he actually defends that. And I thought, well, I said that's a little risky, and there are other people have written to him and said, well, it's kind of risky, but he said, well, you're most infectious before you show signs of infection, and probably the first couple of days even before you
Yeah,
test.
that's,
Question?
excuse me.
Dr. Lagus, is there a origination from that new strain?
No, the new strain is covered. They think the new strain is covered with the current booster. So I think the most important thing is get your booster if you're over 65, or if you're
Correct.
or if you're in a nursing home. And so his thought is that if once you have no fever for 24 hours, you can go back to work.
Yep.
2 years ago, when I was still practicing medicine, we were doing the same thing with strep throat. That if you were on antibiotics and you had no fever for 24 hours, you could go back to work or you could go back to school. It wasn't any longer a 10-day being home. And so we're in the same kind of situation where we're trying to get people back to work, back to school, if they have no fever for 24 hours. You know, no point in keeping them out of school for 5 days or 10 days, you know,
Made a lot of progress there.
So, and so he feels that there's science to back this recommendation up by the CDC. It isn't just somebody's whim, you know, saying this to you. So I think he feels it's a very reasonable thing. The other thing is that a comment was that in the Twin Cities, about 50% of the school kids are not vaccinated for MMR, and their basic vaccine, and they're really concerned about measles. Measles is a very highly infectious disease. I mean, if somebody came in this room, and if you were fortunately, we've either had measles or had the vaccine, we're probably not going to get it. But if you put it into a whole bunch of young people, and this has happened in hospital waiting room where somebody is there and they don't know they have measles and they're infect a whole bunch of people, and because it's just vaporizes in the air, and so
it's always contagious.
It's super contagious, and so and there was a study out of England by Dr. Wakefield who claimed that it caused autism, and so this has been totally
The vaccine or the?
Totally disproven, the vaccine, totally disproven.
This
Well,
has been
depends on
totally
what news
disproven.
channel you watch.
This has been totally disproven, and
That's it out loud.
to the point where he lost his medical license.
He
Because,
did, he lost his license, yeah.
yeah, so encourage your families to get their MMR. So the question to you is, do we still have people are able to exclude their kids from vaccination in school by?
Yeah, our numbers are of vaccinated are.
Pretty low. I think our 24-month-olds is at like 55% right now.
I mean,
We have some parts of the county that MMR is at like 51%.
and don't the medical I mean, was I just not thinking about vaccinations when my children were small? I mean, I know that when I brought them to school, I had to have proof of their vaccination.
Right.
So
Still?
Or an exemption, you can claim an exemption and
what kind of
So
exemption would you claim?
religious exemption.
Or personal, yep. So
I mean, my kids went to Catholic school, so I'm thinking,
we just ask
Yeah,
that
that's
the
kinda-
parents fill out the form, either they're vaccinated or they're working on being vaccinated or they're declining for XYZ reasons. And we want 90% of those papers turned in, but I think we've only had 2 districts this year that even turned in 90% of the paperwork. And we're working with the school nurses in the school districts. It's not that for the school's lack of trying, they're in a difficult position too, as far as vaccines.
Yeah,
Isn't it still an ounce of prevention worth a pound of cure?
Didn't quite understand what you
Yeah,
said.
it is. It's just there's such an anti-vaccine, you know, climate in this country that's the hard thing to fight against.
Right.
I
Okay.
think back in the day, you just got your vaccines or you didn't go to school.
Yeah.
And that,
Did it.
right?
So,
Okay.
does anybody have any questions? If they have burning questions?
Any questions, anybody? Hi, Malia. Thank you.
Okay.
Okay,
Good report, Doctor.
thank you. We love that you bring that for us. Okay, let's do number 11, update on the Drug-Free Communities Youth Summit.
Sure, the Drug Free Community Grant is holding a youth empowerment summit on July 16th. So it's an all-day summit for 6th and 7th graders. We're hoping to get about 60 middle school folks there and then about 12 high schoolers to serve as those like mentors. And then we're looking for at least like 6 adults to help the process. So the focus will be on like mental health promotion, resiliency, and substance use prevention. Northwood Tech has agreed to come and bring some of their mobile like career labs, so students can check those out. We will have the Lionheart Experience, which is a presentation that focuses on like mental health, sense of belonging, all those things that are like pre-substance use prevention type of things. And then we also have other curriculum on resiliency and substance use prevention, in addition to like the ARCS obstacle course and just kind of a fun time. So the goal is to get kiddos who are at risk, but again, anyone is welcome, and that young 6th, 7th grade, and then having that peer support from a high school kind of mentor too. So get those kiddos working together. We're going to be having a planning meeting on Thursday, March 14th from 2 to 3, which is virtual. I can get that link out if anyone's interested. You can nail down more of the specifics to this. Right now, we have 2 sign-up links. One is to kind of nominate a 6th or 7th grader to attend. There's also a sign-up link for adult volunteers. And then transportation is another big question mark that we're looking to kind of solve that problem, because we're really opening up it to all of Polk County. So we want to make sure that if anyone is able to get down to Osceola to our good.
Thank you. And I asked to have put it on the agenda because I'm on the youth, whatever our group is called. And I wanted to just pitch it for any of you who would be adult person to come. So think about that on July 16th. It's south of Osceola, so you just come there and hang out for the day. Rita, put that in your thought too.
Yes, and I'd like that link if you could, Helen, that would be great.
Okay, all right, thank you, Helen. All right, legislative event update.
I have something for you. So we don't meet like we used to down in St. Croix, in New Richmond, where we would have the local legislators come and, just listen to what we needed. However, I do have, just some information on Assembly or Senate Bill, 1015 that was vetoed completely by Governor Evers. There's a new Senate Bill 1015, which is now Act 97 with some of his vetoes. What this is some advocacy around advocacy around a response to the Prevea HSHS systems closing in our region. So it's impacted us pretty significantly here. Birth to 3 was impacted. We have a solution for that. We're in the process of offering speech therapist position and OT. The offers, I believe, are going out today. So knock on wood that we get a couple accepted offers. The other thing is with Sacred Heart and Ellie Phillips. So substance use and mental health, people in crisis, those facilities are closing soonish if they have not already. So this, their 1014 was a grant program for up to $15 million for hospital systems to partner and add beds. So HSHS, Sacred Heart, was in the works for adding beds, and also their St. Joseph's Hospital in Chippewa Falls, adding some more crisis beds to this area. We all know, big problem. Most of our people end up going to Winnebago across the state. We've talked about this. forever. And this was an attempt to be able to increase bed capacity in this western region. So we're not trucking across the state to, for people who are in crisis. So that 15 million, Governor Evers is now saying we need to open that up to meet the needs in their entirety of the western region due to the HSHS closing. Heard today from our WICSA group that, so Governor Evers strongly encouraged the joint committee, finance committee, to expedite this so we could get that money, and others could meet those crisis needs in the region. Heard that the joint committee on finance was not happy about that strong urgency, so there's some delay in getting that money released, if even. I looked on their agenda calendar and it was not on their meeting yesterday. There's no agenda posted for April. So what the recommendation is for anybody in the western region is to contact some of the legislators who are on the joint committee on finance to really urge this. We really need it to move on releasing that money so that we can treat our residents more locally. For the people, the two on that are closest to our area here are Representative Zimmerman, who represents Pierce and St. Croix counties, and then Senator Teston, who is part of Jackson County, La Crosse, and Monroe. So if there's any interest, we can help write advocacy statements for them to expedite this so that we can get that 15 million. I believe it will be done in 2025. So we really want to get access to that to have some more local service with some dollars.
Yeah,
Yeah, I can send you guys some information.
Madam Chair, is this maybe something that we could push up to the board to sign for next and approve for next week? To send to the legislation?
Why not?
So like advocacy resolution to the joint finance. Mo, do you know if
Yeah,
that's
think
part
so.
of procedure? We'll check with Malia.
It's a
How
good
about
idea.
Yeah, let's
Yeah,
do something like that.
Let's, and at the very least, this committee should do something. Yes.
There's
Yeah.
also,
Yeah.
there's 15 clinics from Pravia that are closing in western Wisconsin for lack of funding. And some of them had family practice residency programs. And so all these people who were in those residency programs now have to find another hospital to complete their training.
Perfect.
So it's a real loss. And I think that, I think the issue is that government, federal and state has been cutting funding for various clinic and hospital programs, cutting physician salaries, and for years and years, and pretty soon we're not going to have the medical services that we're having currently in western Wisconsin.
I believe that Oak Leaf clinics in Eau Claire area are taking on some outpatient clinic services, not anything with crisis, but more primary care provider type of services. So they've done that, but really the big gap is in crisis AODA and some of those specialized speech therapies, occupational therapy for our birth to 3 programs. So those are the biggest needs that I see.
Well, it seems
It's
like,
really up to individuals to contact their legislators and tell them to just keep on preaching on this, because the last legislative meeting I was to was Sheriff Knudsen down in St. Croix County. Actually, he just broke down and cried. He said, I don't know what to do. He said, I don't have enough deputies to transport the people. And it's the biggest crisis right now for northern Wisconsin is to get some economical help to solve this problem.
Yeah, I think for us, most of the Sacred Heart beds were typically filled by Eau Claire and Chippewa County residents because it's close. We would get some from time to time. We would get lucky if there was an opening, but a lot of our people do have to end up going over to Winnebago. So something local with bed capacity would be ideal for the residents of these counties.
And I'd recommend each board member though to reach out to those senators individually, but
Exactly. There you go, Bo.
that's
I
gonna
agree, we should reach out and send them emails.
a
right
resolution
away.
forward. That'll do a lot more.
So I will send this committee those contact numbers if you are so
Yes,
inclined
please.
to reach
Yeah.
out to them.
Thanks, Ryan. Yeah. Do you think we could also do something at the board level? So we have two, because not every supervisor is gonna take the time to call maybe?
It'll be a timing thing.
Really, Amy, really, as far as board, you can have a board resolution and they've heard all of them. And these legislators, they're so keen on listening to just common individual people because that's where the votes are.
Okay,
And unfortunately, that's the key to,
what's the timing?
I think they're
getting
still.
something done.
No, yeah, exactly. Okay,
So we'll keep
Get
an
on-
eye on it. If a resolution is appropriate, we will get one drafted. But otherwise, I think the
Absolutely.
fastest way is to pick up the phone and call.
Okay,
Yeah, except they don't
Can
have.
I make one more
yes, go
comment?
ahead.
2 weeks later.
Northwood Tech is gonna have a lab tech, 2-year lab tech course, I think in Richmond this fall, starting this fall. So I think if you have any young people who are interested in STEM type of science courses and are not necessarily going to college, this would be a great training opportunity
Okay,
for them. It's a 2-year course that will prepare them for the certification exam for medical technicians.
cool, okay.
good.
Tell your schools, tell your friends.
I will.
Will they offer it at the campus over here?
I
Or
don't
is it
think
going
so.
to
It'll be,
Richmond
I think
only?
it'll be in Richmond. They're building a building.
Oh.
So the last thing we have on our agenda is what's on for the next April 9th meeting. And today, or we had on our thing, medical examiner should, what is it?
Yeah, she's still flying high,
Should we just
getting
bump?
people hired. So I moved her
Yeah,
to April
to April?
or May.
Okay, okay.
We're getting a couple of deputy examiners trained up, so she's quite busy right now.
Yeah, that's fine.
Mhm.
And this is still the old one, so if you have any other updates, just.
Anything you want for April?
We've got the VSO, he wanted to do a presentation. I do also think we are going to get in front of you guys on our out of home placements. We've got some kids out of state, actually quite a few, so we just want some awareness on that.
What was the first thing you said?
The VSO, the veteran.
And-
Oh, Andy, okay.
Andy wants to come and talk,
Sure.
and then the update on the placements, which will have budgetary impacts.
Okay.
Yep.
Got anything over there, Denise? Okay. Take a motion to adjourn.
Madam Chair,
Sorry,
Madam
John.
Chair, I wanna thank everybody that's been on this committee. We'll be having a new committee in April. And once again, thank everybody. I think we had a great committee and I make a motion to adjourn.
I'll second it.
Second.
Oh, I don't
Adjourn.
think-
All in favor? Opposed, same
Aye.
sign. Thank you, John.
Oh, you, John.
Thank you.